I was going to ask about the interface issue, and you've kind of addressed it already, that there's a multitude of interfaces with the police, with education services, with various other bits. So I was going to ask about it, but you've kind of answered that. And the answer seems to be that the people that you work with are professionals who are trained to work together in the way that Bob's outlined, and they'll overcome any barriers that politicians want to frequently put in their place. And that seems to be, I don't want to, I'm sure that's what Bob meant. I'm sure that's what he meant. But what I really want to know is, are there any members of staff that you're working with that are crying out for this change? Are they saying we must have a national care service to overcome these problems? Is that happening?
I think the important point is, I think most of the staff would say, particularly on the back of the promise, that what we're doing for families at the moment is not good enough, and there needs to be some kind of change. So I think they recognise that. What they're concerned about is going into the unknown, that we unpick everything, and at the moment we don't have enough detail to say that the level of disruption will be worth it overly to get us to somewhere else. How do we not strengthen what we're doing at the moment?
So what you're highlighting is, of course, I think you're all talking about change. I mean, Mike was just talking about trying to up the budget for prevention versus other spend. So you're constantly changing. But is it structural change they're crying out for?
No. No, or what I would say to you is that what I think staff recognise, because again, we've all been in this, as we've been through local government reorganisation, we've been through joint, is that structure in and of itself will not give you the changes. And I think that's where people they recognise that it's much more complicated than that, it's much more nuanced than that. And particularly, and it kind of relates back to Mr Doris's point about kinship carers, we need to be able to invest in children's services. That if there's no further investment, any change in structure, again, will be more disruptive.